Arterial blood gas, or ABG, is a crucial test in medicine that helps us understand two main things: the acid-base balance and the levels of oxygen and carbon dioxide in the blood. By analyzing these values, clinicians can quickly assess how well the lungs and kidneys are working and whether the body is maintaining a healthy internal environment. ABG interpretation is foundational for diagnosing respiratory and metabolic disorders, making it an essential skill for healthcare professionals. In this video, we'll break down the basics, walk through the main disorders, and show you how to approach ABG results step by step. The foundation of ABG interpretation lies in understanding the relationship between pH, bicarbonate, HCO3, and carbon dioxide, PaCO2. This relationship is mathematically described by the Henderson-Hasselbalch equation. The equation helps us predict how changes in bicarbonate or carbon dioxide will affect the blood's pH. Knowing this, we can identify whether a patient is experiencing acidosis or alkalosis, and whether the cause is respiratory or metabolic. Let's explore how this equation guides our interpretation and why it's so central to clinical practice. The Henderson-Hasselbalch equation is a cornerstone of acid-base physiology. It states that pH equals pK plus the logarithm of the ratio of bicarbonate to carbon dioxide. This formula allows us to calculate the pH of blood based on measurable values, and it's the basis for understanding all acid-base disorders. By manipulating this equation, clinicians can determine whether changes in pH are due to respiratory or metabolic factors. Let's visualize this equation and see how it's applied in practice. There are 4 primary acid-base disorders that clinicians encounter: respiratory acidosis, respiratory alkalosis, metabolic acidosis, and metabolic alkalosis. Each disorder has distinct causes and clinical implications. Understanding these categories is the first step in ABG interpretation. We'll briefly introduce each disorder before diving deeper into their mechanisms and presentations. Respiratory acidosis occurs when carbon dioxide builds up in the blood due to decreased alveolar ventilation. This can happen in conditions like chronic obstructive pulmonary disease, COPD, drug overdose, or neuromuscular disorders. The excess CO2 lowers the pH, leading to acidosis. Recognizing respiratory acidosis is crucial, as it often signals underlying respiratory failure or hypoventilation. Let's look at the typical ABG findings and clinical scenarios. Respiratory alkalosis is the opposite scenario. Carbon dioxide is lost due to increased alveolar ventilation. This can occur during hyperventilation, anxiety attacks, or certain lung diseases. The loss of CO2 raises the pH, resulting in alkalosis. Identifying respiratory alkalosis helps clinicians address underlying causes, such as pain, fever, or hypoxemia. We'll review the ABG patterns and common triggers. Metabolic acidosis arises when there is an increase in fixed acids or a loss of bicarbonate. Common causes include diarrhea, diabetic ketoacidosis, and renal failure. The drop in bicarbonate leads to a decrease in pH, causing acidosis. Recognizing metabolic acidosis is vital for prompt treatment, as it can quickly become life-threatening. We'll discuss the typical ABG findings and clinical examples. Metabolic alkalosis occurs when there is a loss of fixed acids or a gain of bicarbonate. This can happen with vomiting, excessive diuretic use, or overinfusion of bicarbonate. The increase in bicarbonate raises the pH, resulting in alkalosis. Understanding metabolic alkalosis helps clinicians manage electrolyte imbalances and fluid status. We'll highlight the ABG findings and typical causes. The body has 3 main systems to compensate for acid-base disturbances: buffers, the respiratory system, and the kidneys. Buffers act immediately, neutralizing excess acids or bases. The respiratory system adjusts CO2 levels within minutes, while the kidneys regulate hydrogen ions and bicarbonate over hours to days. Understanding these mechanisms is key to interpreting ABG results, as compensation can mask or reveal underlying disorders. Buffer systems are the first line of defense against acid-base disturbances. The main buffers in the blood are bicarbonate, phosphate, and proteins. These systems act instantly to stabilize pH, preventing rapid changes that could harm cells. While buffers provide immediate protection, their capacity is limited, and other systems must take over for sustained balance. Let's visualize how buffers work in the bloodstream. The respiratory system compensates for acid-base disturbances by adjusting the rate and depth of breathing. This changes the amount of CO2 exhaled, which directly affects blood pH. For example, in metabolic acidosis, the body increases ventilation to blow off CO2 and raise pH. In metabolic alkalosis, breathing may slow to retain CO2 and lower pH. These changes happen quickly, making the respiratory system a powerful compensatory mechanism. The kidneys play a crucial role in long-term acid-base balance. They regulate the retention and elimination of hydrogen ions and bicarbonate. In acidosis, the kidneys excrete more hydrogen ions and retain bicarbonate. In alkalosis, they do the opposite. Renal compensation is slower, taking hours to days, but it's essential for sustained pH control. Let's see how the kidneys adjust these parameters over time. Hypoxemia, or low arterial oxygen, can result from four main mechanisms: alveolar hypoventilation, diffusion impairment, shunt, and ventilation-perfusion mismatching. Each cause affects oxygen delivery differently and requires specific interventions. It's important to distinguish between SO2, oxygen saturation, and PaO2, partial pressure of oxygen, as they are not equivalent and provide different information about oxygen status. Interpreting ABG results involves a systematic approach. First, check the values against normal ranges. Next, determine the primary process by analyzing the pattern of pH, PaCO2, and HCO3. Then, evaluate for compensation or mixed disorders using established rules of thumb. This structured method ensures accurate diagnosis and guides appropriate treatment. Let's walk through each step in detail. Knowing the normal ranges for ABG parameters is essential for interpretation. The typical values are pH 7.367, 4 mean 7.4, PaCO 2 35 45, mmHg mean 40 mmHg, HCO3 27 mEq, L mean 25 mEq, L20 PaO2 80 mmHg, which decreases with age. Comparing patient results to these ranges helps identify abnormalities and guides further analysis.